Let's get back to Capitol Hill, though, and to Bloomberg's Peter Cook, because he's with Senator Charles Grassley of Iowa. Peter?
Thanks. It's a busy day here on Capitol Hill, Betty. We do have the Treasury Secretary talking about financial overhaul, financial regulatory reform, but at the same time, the Senate trying to deal with the issue of health care. We've got the Senate Health Committee dealing and meeting on their proposal, and the Senate Finance Committee was supposed to be meeting, coming up with its own plan right now, and Charles Grassley is the top Republican on the Finance Committee, and can you give us an update? We understand that maybe there's a delay in consideration of a bill in finance. What's going on?
Well, what's going on is we got a report on what CBO, Congressional Budget Office, they scored, how much it cost. The cost came in greater than we anticipated, so we're doing the term we use here, we dial down programs and expectations to fit into a figure, and we're in the process of doing that. There's still some policy that's not decided, and quite frankly, CBO can't score a whole package until we get all the policy decided. So two fronts. One, we're trying to get some rescoring done right now on what we do have policy on, and we're trying to settle the policy that's not settled yet. And so we did have a very hard date of June 22nd, and you know, if you'd asked me yesterday, I'd say we're still on course to do it June 22nd, but we've come to the realization now that it's going to be sometime later on, and I'll use the words of Chairman Baucus, who I respect very much. He says we're going to wait until we get it done right, and so that's going to take a few more days, but either just before July 4th break or right afterwards would be my judgment.
There are people suggesting this is the first, if you will, step backwards for healthcare. This is the first indication this is going to be a heavier lift, a harder challenge than people first thought. The dollar figure alone, $1 trillion, is that the target you all are looking for right now?
Well, it's pretty difficult to put a solid number on it, but there is going to have to be some upfront money to get the people that aren't insured. So our goal is accessibility and affordability of insurance. Nobody should go without insurance, and my goal is to have a 5-year payback on that, and so I'm going by the principle of a 5-year payback as opposed to a specific number at this point.
But you don't see this delay right here being an insurmountable obstacle. You're still optimistic a bipartisan agreement can come forward?
I'm very optimistic, and let me go further. I think that it isn't just health care reform. We're restructuring 17% of our economy, and it ought to be done in a thoughtful way. It ought to be done by a consensus, and that means a bipartisan bill, and that doesn't mean with just a bare majority of votes. That means a broad consensus. So we're looking to write a bill that will get a massive number of votes. And the reason why bipartisanship is important, I've given those reasons, but the other two efforts on the Hill, one in the Health Committee of the Senate, is very partisan, and of course coming from the House of Representatives will be a very partisan bill. We should not be doing this in a partisan way. We're the only forum for bipartisanship, and I think we're the only forum for success.
How are you tackling the issue right now of a public option and government option? You've opposed that from the start, like many other Republicans. There's talk of maybe looking to co-ops, nonprofits, to fill that role. Is that the approach you're taking?
If the people proposing the co-ops think in terms of the way we've known co-ops for 150 years in agriculture in the Midwest, and maybe with credit unions, thing of that nature, and it's private sector run, then I think it's a good thing.
What about the idea of a trigger mechanism here? You've got private insurance, but if they can't lower their costs, if they can't cover everyone, then maybe you, at a date in the future, you allow for a government option if they haven't made enough progress.
Well, now listen, I just stated to you that our goal is accessibility, and that means for all 45 or 50 million people that don't have insurance, and those that can't afford it will be subsidized. So the issue of what if somebody can't get insurance, our goal, our number one goal, is to make sure they get insurance. So why all the other questions? There's no basis for the other questions.
All right. You still have optimism right now. There's a deal.
Of course I do.
A deal can be had.
Yes, of course I do.
All right. The eternal optimist here on Capitol Hill, Senator Charles Grassley of Iowa. As always, sir, appreciate the time. Thanks for joining us. The latest breaking news on the health care debate here in Congress. Betty?
Okay, we're watching that, of course, very closely. Thank you so much, Peter Cook in Washington.